So this is
Yeah,
important. This is why I wanted Dr. Schaefer on here because this stuff is really new as well. And
yeah,
so I want him to talk about, I think let's start with the one that's more common, which is the cervical disc replacement, and kind of
absolutely.
tell
Yeah,
about the differences in that and really why it's better for younger patients and what's the benefit. And then
yeah,
let's talk about lumbar because lumbar to me is valuable, but I also have a personal interest in this. So,
yeah.
this to me at first, obviously cervical. So, tell us what's a cervical disc replacement, and we'll maybe throw up the slide there so people can see.
So,
And then yeah, there you go.
so one of the ways that you can help patients. So generally, when you're doing surgery in someone's neck, it's for nerve compression. Okay, and it's for nerve compression from a disc that's herniated, that's squeezed out the back and pushing on the nerves. Right, like we said earlier, nerves don't like being touched by anything, including pieces of your own body.
Hmm.
So one of the most powerful ways of getting that compression off is by taking that disc out from the front generally, which believe it or not is easier for patients and is less invasive than going from the back. But going through the front, finding the disc and pulling it off, decompressing the nerves, and once you've done that, you have a space that's open, and that can be that's a lumbar disc replacement there.
We'll go back to the cervical one
But
just to
yeah,
keep it on there.
once you get that space open, you have to put a spacer in there to sort of hold the bones apart and keep all of the anatomy in the right place that it's supposed to be in. You can do that one or two ways. You can do that with a fusion and with a static spacer that doesn't move, or you can do that with one of these disc arthroplasties that you see here. And what those do is those have end plates and a little core that allows the end plates to move and flex and bend.
So
That's
more natural, right?
much more natural. You don't lose as much. You don't lose as much motion. And what we're finding is there's a risk of something called adjacent segment degeneration, right?
Well, this is what you were talking about.
Yeah.
Where when you have one segment that's fused, all of the patients still move, right? Just because you fuse one level doesn't mean your neck is going to be rigid. You're going to move. You're just going to put more stress on the other discs while you're doing that. If you're young, that means you have a longer lifetime of more stress being put on the discs.
Hmm.
Also, you think about your 30-year-old patient, your 35-year-old patient, they're doing more intense things, right? They're doing CrossFit, they're running marathons, they're doing things, they're really using their neck as opposed or their spine as opposed to maybe it's a little fewer and farther between to see a 65-year-old doing workout of the days, right? And so younger patients put a lot more stress on their neck, and if they have a level that moves, that's a lot better for them. Ultimately, because there's a lower risk of adjacent segment degeneration, but there's also better outcomes. Patient reported outcomes are far superior with a disc arthroplasty. My brother had a disc herniation, and I made sure he got a disc arthroplasty as opposed to a fusion because he's younger than me. He's in his 30s, and so it's really important to I think to preserve motion in the spine as much as you can. And so I'm maybe a hair less passionate about cervical disc arthroplasty and lumbar disc arthroplasty than I am um, about endoscopy. Right? I like endoscopy, but I love disc arthroplasty as well. There are some times when you shouldn't use a disc arthroplasty, and a lot of that is based on how much arthritis you have in your facet joints, and those are the joints in the back of your spine behind your spinal cord. And so some people disc arthroplasties still aren't aren't a good option in. But
How
by and
does
large,
arthritis affect that? Just so we can have a better understanding. If you have arthritis build up back there, why wouldn't you want to do something like that?
so if you have arthritis in your neck in the facet joints in the back, they still move when you have a disc arthroplasty. So you can still have residual pain in the back of your neck. It may be something that you can tolerate. And so that's why it's always a conversation with your physician,
Yeah.
right? We always talk about what the goals are. But it may be something that you need that if neck pain is a big part of what's going on, as opposed to arm pain, then sometimes you say, yeah, well, maybe we should do a fusion. But generally most patients, especially younger patients, do a lot better with disc arthroplasties as opposed to fusions.